Hello, my name is Celestia, and today I will be tackling the claim that has haunted many Dr. Pepper drinkers such as myself, which is, do artificial sweeteners actually cause cancer? Artificial sweeteners are often used as ingredients in food or beverages labeled sugar-free or diet, and are a staple in most American grocery stores. They are markedly many times sweeter than table sugar, which means much less can be used. They add virtually 0 calories to the intended food or beverage, and typically do not raise blood sugar. Currently, the FDA has approved these 6 artificial sweeteners as food additives. The FDA uses the latest scientific research to determine if an ingredient is safe to use and establishes an accepted daily intake level, or ADI, or the amount one may consume safely each day over the course of one's life. On to carcinogens, but first, let's talk about cancer. Normally, in the human body, cells grow and multiply via cell division as needed, then subsequently undergo a programmed cellular death or apoptosis when damaged or old. Cancerous cells do not follow these rules. They undergo rapid division and multiplication in the absence of signals that would tell them to, and forgo apoptosis. They may invade other parts of the body or metastasize, form solid masses or tumors, and even trick the immune system into helping them survive, grow, and spread. Even benign or non-cancerous tumors can be dangerous. Cancer is genetic or caused by Cancer is a genetic disease or caused by changes to our genes. Some cancers may be inherited, and others may be caused by outside exposures or environmental factors. Carcinogens are substances and exposures that can lead to cancer. To determine if one is, and the level, scientists may use lab tests on cell cultures in animals or epidemiology studies. According to Cancer.org, almost all carcinogens first tested on and are found to cause cancer in lab animals are later found to cause cancer in humans. In July 2023, the World Health Organization classified aspartame as possibly carcinogenic, falling into the IARC's category of 2B, in which there are no or limited evidence on humans but limited or sufficient evidence in animals. JEFCA, or the Joint Expert Committee on Food Additives, established an ADI of 0 to 480 milligrams per kilogram of body weight for aspartame. According to my research, the conclusions mainly stem from research done at the Ramazzini Institute. Starting in 1997, they started a large experimental project on rodents to test the carcinogenic effects of aspartame starting treatment from prenatal life and observation until spontaneous death. The results found that in experimental animals, dose-related increased incidence of several types of malignant tumors and, among them, hematological neoplasia and liver cancer. These findings were controversial. Critics challenged the accuracy of RI's diagnosis of hematopoietic and lymphoid tissue tumors, or HTLs. It specifically contradicted a study done in 1981 by Ishii to assess the potential for aspartame to cause brain cancers in Worcester rats, which found the artificial sweetener to have no effect. Critics claimed that pulmonary lesions observed in aspartame-exposed animals were inflammatory lesions caused by mycoplasma infection rather than malignant neoplasms, and even conducted histological evaluations of the stored studies years later to back up the claim. An important side note, the Ishii study was conducted at Ajinomoto Co., where subsequent challenging authors were also employed. This is an aspartame supplier. As a result, RI subjected all HTLs from aspartame-exposed animals to immunohistochemical analysis and morphological reassessment using the most recent internationally harmonized nomenclature and diagnostic criteria. This reevaluation confirmed the original diagnosis of malignancy in 92.3% of cases. 6 lesions originally diagnosed as lymphoma were reclassified as follows: 3 to lymphoid hyperplasia and 3 to chronic inflammation with fibrosis. There was no evidence of mycoplasma infection. Epidemiologies, however, are limited. A study on a French population-based cohort found that artificial sweeteners, especially aspartame and ACE-K, were associated with an increased cancer risk. Linkages between increased aspartame usage and obesity are not off the table as well, in which the consumption in humans does not point to a causation of cancer, but the obesity does. My conclusions are that it is complicated. We are still in the early stages and there is limited research. However, the claim that almost all carcinogens first tested on animals that are found to be carcinogenic are almost always later found in humans is very worrying. Bias also seems to be very rampant. If artificial sweeteners, such as aspartame, do happen to be carcinogenic, it seems like it would be very consequential to big businesses and they would lose a lot of money. So there is that as well. Well, thank you so much for viewing my presentation and have a good day.